digital tools be skillfully designed and deployed to promote quality of life. I think the topic has already come up that technology can be a double-edged sword, right? I mean, our phones can really, in particular, can really go both ways in terms of quality of life. And what we find is that it's not necessarily trivial to figure out how to use this really powerful technology to actually make a difference. And so I'm going to show you some of the lessons that we've learned. Some of the components of this are the efforts that we actually have in place operationally. This is a person-centered research and development model. So we think about the whole person and how do we address all of their needs. And in our case, particularly military veterans, and particularly military veterans who survived traumatic stress. An area that I particularly focus on is effective engagement, which really means how do people use these tools in ways that actually drive the outcomes we want to see? For example, improvements in quality of life. In Silicon Valley, engagement has all kinds of purposes, and for example, it can be to get you to watch an advertisement, to get you to make an online purchase. So in our case, we're really thinking about what kinds of engagement will lead to positive changes, and how do we promote that. I think a really interesting topic is the interaction between and the relationships between humans and technology. And what we've seen is this is a critical area for thinking about applications of this kind of technology, and there are a lot of complex trade-offs. And then finally, I'll just touch on this topic, but another thing that, another major part of my work is looking at precision treatment. So getting down as close as we can to the individual and tailoring and targeting what we provide to their individual needs. So just a little bit about the VA. As I mentioned, the VA is the largest integrated healthcare system in the US. We have 9 million veterans in our care. 1.7 million of those are in some form of mental health treatment across over 170 medical centers, over 1,300 medical facilities. And on the right-hand side here, you can see the VA has adopted a person-centered model that's called the whole health model. And this is a diagram of the circle of health. So this is maybe another way to conceptualize quality of life from a healthcare perspective. You can see mindful awareness, self-awareness at the center, emotional, physical environment, nourishment, sleep, all these kinds of components, and then medical treatment, community, environment, forming concentric circles around the person. So this is really, again, a model for how to think about delivering healthcare and how technology can fit into this. A major part of what we do at the National Center for PTSD in my division is we have a mobile mental health application program. And I just want to note that what I'm presenting here is not only my work, but work of an incredibly talented, hardworking team of many folks. Some of them will be named on some of the slides. There are many more who aren't, so I just want to acknowledge all the folks who have been contributing to this program, which started in 2011 and was really one of the first digital mental health apps initiatives out there. So we've now grown to over 20 free mobile applications. These are all available. You can use this QR code and download them right now if you'd like, if you're interested, or go online and find there's more information about these at this link. We've had over 5 million downloads as of last count. We have tens of thousands of active users every month. So I really want to emphasize that this is an operational program one that's been in operation for over a decade now. So that's really something that I think is puts us in a special position. Some digital mental health initiatives are more academic and are really more focused on initial research, but it's very hard to get to deployment at large scale. And vice versa, for example, there are many commercial platforms out there with the scale, but who are not in a position to do the kind of open public health focused research, sharing of results, and so on that we are. So we're really privileged to be able to take a public health approach to these digital tools. Some of the principles that we use are participatory design. So all of our apps are developed together with veterans and also together with practicing clinicians in the VA system, so that we make sure that these apps actually are relatable, the language we use is appropriate, and connects with the people who we want to be using these apps. all of the content, of course, is all drawn from evidence-based sources. So we put a lot of emphasis on rigor, and that's another thing that distinguishes these apps from the many, many thousands of apps that identify themselves as mental health apps out there. So we can offer a trusted source of information. We put a lot of emphasis on equity and accessibility. So we also, in the design of the apps, we make sure that avatars, graphics, language, again, are inclusive. The apps follow federal guidelines for accessibility, for vision impairment, auditory impairment, and so on. They also are they're designed to be compatible with a very wide range of phones, place very low burden. They work offline. So for example, in our population, there are many veterans who live in remote places. So these can often provide resources to people who may be tens or even hundreds of miles from the nearest clinic or medical center, and they can still access these resources, whereas they might not otherwise have anything. Trust and privacy is a really big one. I think probably a lot of people have seen various news headlines about issues with data collection, data sharing, and this is mental health data is one of the most sensitive types of data. This is, again, an area where we're in a position to provide a high level of privacy. We don't ever require any logins. We don't ever collect any personal data on these apps. So again, for people who are dealing with very sensitive problems, these apps can be a safe way to do that. We have a continuous R&D program, and so that's a lot of what I do is studying these apps and how they work and who they work for. And then we feed that back into the development of the updates and new apps. And then finally, we have an active outreach program. We're constantly, we have mobile health ambassadors across the country. We deliver free talks. There's a link at the end of my talk to free talks that any of you can watch if you're interested, and we have video archives of all of them. So I just wanted to outline these as some of the components of a public health model for delivering digital mental health tools. And these would be things to think about for anybody who's thinking about mounting a program like this. I also want to note that we have, for a long time, also had a big network of worldwide partnerships, and this is something that's very exciting to our group and that we're very open and interested into, and I think something I want to emphasize to this audience in case there are folks here who would be interested to talk about this. We do many academic research partnerships using the apps to mount a clinical trial in a particular population or study them in other ways. We're very happy to work with folks who are interested in doing that. We have partnered with governments and militaries around the world to adapt these apps, for example, to other to militaries of other countries or to particular situations. We have more recently started working with nonprofit organizations. I'll mention one of them in a minute. And also with private sector healthcare systems who would like to integrate these tools into their offerings. So on the right-hand side is a list of some of the countries where we have partnered and where these apps are being deployed and in use in various adaptations and versions. And so this includes translations into other languages. This can include adaptations of the content to local content. So again, by being a public sector group, we have the privilege to be able to offer this kind of thing very openly. And so as of this is a growing list. As of now, to my knowledge, I don't think we have any partnerships in Poland, but it would be really wonderful if we come out of here with one. I'll talk a little bit about a few of the apps. Again, I mentioned, we have
2 minutes.
over a dozen, yeah. So one of them is PTSD Coach. This is our flagship app. This is really for learning about PTSD, tracking symptoms, learning healthy coping skills, building support, connecting with treatment resources. None of these apps are intended as treatment, and they're actually intended to encourage people to access treatment with providers. But we have found that these coping tools can help people significantly managing their symptoms, and in particular for some people who may not otherwise want to or be able to access conventional forms of treatment. And as I mentioned, we've started working with nonprofit organizations. In particular, one organization, Commit Global, has translated and adapted the PTSD Coach app into an app called PTSD Help, translated into both Romanian and Ukrainian, and that app is being marketed, advertised, and they're looking for partners all over Eastern Europe. So, and in any areas where there are Ukrainian refugees or people affected by the situation in Ukraine. So again, if there are anybody here who's interested to connect with this group or connect with us about that, we don't have a Polish translation yet, but we would love to get one going, or partner with Polish clinical institutions or clinicians to disseminate and raise awareness of these apps. Just to give you an idea of some of the other apps we have, Insomnia Coach is a kind of fully self-contained app that can provide education, but also can provide an entire guided 5-week plan based on cognitive therapy for insomnia. And so we've had people complete this independently. We've seen improvements in insomnia and sleep-related impairment, which is a huge factor in people's quality of life. We have a mindfulness app, and I'll just, for time, I'll just kind of whiz through some of these. Some of the things that I look at are which are the tools in these apps, which ones do people use the most versus which are most engaging, which are most effective, so that we can kind of continuously optimize them. We look at human use versus app use, and does adding coaching and clinician support improve people's ability to use these apps. And here's another example where the app visits, clinician support interactions actually promote app use in the time surrounding those interactions. And then there are many other initiatives going on in the VA. For another project I'm involved with is looking at digital interventions for caregiving diads. So caregivers and veterans doing programs together with online coaching. And then we're also using machine learning to look at what drives effective engagement in some of these online interventions. You'll notice I haven't mentioned AI. We're of course thinking about it and working on it, but as an operational system, we are also very focused on deploying things that we can be really confident in. So we're working towards that. I have a list of questions, but I also think Jersey also does. So I'll skip those. Please contact me if you're interested to learn any more.
Thank you, Joseph.